Good afternoon. I hope that you had a good surgery and a good experience with us. I'm just going to go through the post-op instructions. You will have received a little bag like this with the instructions all printed out, and we also emailed you all the instructions as well, but I'm going to go through it with you in case you forget anything on the day. So there's a few bullet points that you'll see on the piece of paper in the front. The first one is, for the first 7 days, don't smoke, try not to drink any alcohol or caffeine, as this does impair the healing process. It is also recommended that you have a light meal after the procedure, so we'll usually have gotten you a meal for this, but also you can have a light meal after in the evening. There's usually minimal pain after the surgery, but it's still recommended that you take the anti-inflammatory tablets that I'm going to show you just now. Usually swelling post-op is very normal. It can usually go to your forehead and sometimes between the eyes, and remember, swelling will always go to gravity, so you might even get swelling under your eyes as well over here. Don't be alarmed, it's 100% normal and it will go away in a few days. Also, if you might sleep on one side more than the other, you might find that one area or one side of your face is a little bit more swollen than the other, which is also 100% normal, so don't stress about that. Sometimes when the skin is healing a few days or a few weeks after the transplant, the skin can feel a little bit itchy. That's also very normal. You can also send me a picture or let me know if you're concerned about this, but healing skin and itchiness is normal. You can take the normal Allergex, which can also help you sleep as well to help with the itching because it's an antihistamine. The transplanted hair will usually fall out around week 1 to week 4, which is completely normal, and it will start regrowing from about 4 months to 6 months post-op, so don't worry about that as well. The hairs that you see coming off with the scabs is just the old hair shell, but the root is safely inside under the skin. So also don't stress about any scabs and hairs falling out together. Also, if you previously used to dye your hair, you need to wait at least 4 weeks after your procedure. If you've used hair dye that you haven't had any issues or allergic reactions with, don't try any new hair dyes after the procedure as soon as 4 weeks. Do not swim in the sea or the swimming pool for at least 2 weeks, because we need all the wounds to be 100% healed and all the scabs to have fallen off, which is usually about 2 weeks for most patients. And then exercise. So we get a lot of questions about exercise. You can resume light activities 3 days after the surgery, and then more vigorous activities like wrestling or very heavy weightlifting, I would wait at least 2 weeks. For the first 3 days or first 72 hours, avoid bending down. So avoid having your head lower than your chest, because that can increase the pressure on the grafts. It's important to protect your head against direct sunlight and sunburn. So you can wear a cap if you're going to be out in direct sunlight. You don't have to wear a cap all the time, but just if you're in very hot sun. Now I'm going to go through what we will give you in this little bag. So everything that I'm talking about is going to be on this piece of paper over here. So you've got an antibiotic, which is ciprofloxacin. It's not penicillin, so even if you are allergic to penicillin, this is fine. The second medication is called Genpains, which is just a mix of Panado, Brufen, and codeine. And then the last medication is called prednisone, which is a corticosteroid. So this one helps with swelling. The other things you'll find in your bag is just shampoo. You'll also find some saline spray. And then you'll also find this over here, which is a little bit of cream, and then you'll also find a linen saver. Okay, so we're going to go through all of this now. This is called ciprofloxacin, which is an antibiotic. You take 1 in the morning and 1 in the evening. If your surgery finishes early enough, we'll probably have given you one of these antibiotics just after your surgery, so you can take your other one in the evening. And this is for a 5-day course, so you can take this with food. And because it is an antibiotic, you can also take a probiotic with it if you like. The Genpain is for pain and swelling. You can take 2 at a time, and you can take it 3 times a day. I'm just going to show you what they look like. So the Genpains are the red and green tablets. Okay, and we give you a full box. And then the prednisone, so the prednisone is a little bit more complicated. You have to take 8 tablets, so all 8 tablets in the mornings for 4 days. Each tablet is 5 milligrams and you need a dose of 40 milligrams. So that's why it's 8 tablets. 8 tablets every morning for 4 days. This will help with the swelling. So that's your medication. If you have any allergies or anything, please let us know beforehand. These things might change if you do have any allergies. Then the post-transplant saline spray. So this is just normal saline. You will probably experience a lot of spraying during the procedure. So all you do is you just spray the implanted hairs, not the donor hair because that will be covered, just the implanted hairs every 30 minutes. So every half an hour for the first day until you go to bed, just to keep the implanted grafts sterile and also moist. So this will be for the first day, but you can also use this on day 2 and day 3 if you want, but you don't have to be as regimented as day 1. This is the shampoo that we're going to give you for sensitive scalp for post-transplants, but you can only use this 1 week after your surgery. So exactly 7 days after your surgery, we will do your first wash for you, or you can do it yourself, and then you must use this shampoo. After your first wash, then you can wash your hair every day until all the scabs have come off with this shampoo. And then this over here is just some extra dressing that you'll need if you are changing your bandage by yourself. But most patients come to us the next day for us to change their bandages for them. But what you'll find is this is post-transplant cream. So what it is, it's a mixture of Aquaphor. I actually have Aquaphor here in case it sounds familiar. This is Aquaphor. So it's a mix of Aquaphor with antibacterial ointments in this as well. So some Superiorban is also in here. And then this is just a applicator stick, so you can just use the stick and then you can just wipe it over the extracted area, and then you can just put some more gauze over the area. But usually we will do the bandage change for you. Also, there is another video explaining how to change the bandage at the back of the head, which you can also refer to. And then this over here is called a linen saver. So the blue part is waterproof. So that's the part that goes on the pillow, and then you can sleep on the towel part. And that's just if you're worried about any blood getting onto your pillow. But usually bleeding should be very minimal. And then if you just see on this piece of paper right at the end is all of our numbers. So you're more than welcome to contact me at any time if you're stressed about anything. And yeah, I hope you have a good rest your first night, and let me know if you have any questions. Thanks.